So away from politics, we head to health matters, and let's talk about cholera outbreak. And it has been confirmed that close to 200 deaths have been reported in the country since the outbreak of cholera in August last year. Now, despite being a disease that can be prevented, cholera cases countrywide has hit the 12,000 mark. So why is this the case? Our Health and Science reporter Gloria Milimo looks at some of the barriers that threaten the fight against the disease in Kenya.
Like its counterparts in the continent, Kenya continues to grapple with active cases of cholera that remains a threat to public health. The recent outbreak in Migori County that claimed the life of 5 people, leaving several others hospitalized, is just but among cases that continue to be witnessed in the country. Since the outbreak of cholera in August 2022 in Kiambu County, at least 26 counties, according to data by the Ministry of Health, have been hit by the highly infectious disease.
We have been able to control in about 24 counties. But there are other counties that are still having active cases. About in the last 2 weeks, we have recorded quite a number of cases from Migori County, about 10 cases, about 20 cases, and about 7 cases from Nairobi.
As of 23rd of August, 12,036 cases were reported, out of which 199 patients lost the battle to the disease. Experts say cholera remains a significant public health threat, and its resurgence is catalyzed by several factors. They say most people infected do not show symptoms immediately, although the bacteria is present in their feces and are shed back into the environment, and this can potentially infect other people.
Today, you will find that with globalization, people are moving from very many parts of the world to others. And even within our own context, there is a lot of travel across the country. And so it becomes very easy for somebody who is infected to move to another place and spread the disease there. So you'll find that controlling it becomes very difficult because of those dynamics.
To help stop the disease in its tracks, public health experts advise the need to vaccinate people from high-risk areas with oral cholera vaccine and complement the initiative with improvements in water and sanitation. This, however, remains a challenge in the country. At least 1.6 million people have been vaccinated so far in the 10 days vaccination exercise that targeted 8 counties, among them Garissa, Nairobi, Machakos, and Kajiado. Although the campaign was rather successful, county governments are still struggling to tackle the cholera scourge effectively.
A lot of what we expect, these whole things we are talking about, all these things around the water, environment, the multi-sectoral approach, should really now be done at county level. So what we are seeing is that much as some counties are really coming up very well to be able to take up this function, we still need to really give it a push so that they can now be able to do much more.
A global cholera strategy aims to reduce cholera deaths by 90% before 2030, and Kenya is among countries that subscribe to this push. Through efforts geared towards primary health care that places emphasis on prevention, Kenya hopes to curtail the spread of cholera that researchers estimate affects at least 4 million people and kills another 143,000 globally annually. Gloria Milimo, KTN News.
So now Prime Cabinet Secretary Musalia Mudavadi is asking the Kenya